subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We are today on April 1. It's All Fools Day. And we're discussing an issue which has been kind of teasing us for the last 3 years. And, given the number of cases that we've been having of H3N2 and influenza and COVID cases, we thought it would be good to have a special edition on this. You know, in the past as well, we've been having a lot of sessions on COVID readiness. We've had some of the best internal medicine and emergency doctors from across the country on our show. And today we have Dr. Sohini Sengupta. Dr. Sohini Sengupta is the medical laboratory director at Redcliffe Labs in Delhi. And she's the head of the Department of Clinical Biochemistry and Special Assays. She's an MD and a DNB in Clinical Biochemistry and FNB in Laboratory Medicine. She is a corresponding member from India on the IFCC committees on POCT and laboratory errors and patient safety. She's a green belt in Six Sigma processes. She has published her research work in national and international journals and is an invited speaker on various platforms. It is our pleasure to have Dr. Sohini Sengupta here. Welcome to Health Live at Seniors Today.
Thank you, Dr. Pradyuman, for the nice introduction. And good afternoon to all of you.
Yeah, it is, I'm not a doctor, but although I've been interviewing a fair number of doctors through my journalistic career and over the last 3 years, but a little learning is always a dangerous thing, as we know, and we try and ensure that our readers here, and all of them are senior citizens, get the best of advice from top doctors and who are on the cutting edge of present day medicine.
Yes.
So, tell me, doctor, is this what's happening right now? Influenza and H3N2 and various other new names that we keep hearing about. Is this all a source of worry?
See, right now, there is a mixed bag of things that's going on. Over the last 3 years, it's mostly been COVID. But, around this time of the year, it has always been a prevalence of influenza, what we more commonly call seasonal flu. So, right now, what we are having is a mix of influenza, that's the seasonal flu, then also COVID-19 simultaneously. When I speak of influenza, what happens is influenza has different strains. And of course, you might be knowing that, they are viruses. So they continuously undergo a lot of reassortment, what we in medical terms call mutations, and therefore come up with new strains every time. A new strain that's happening around is the H3N2, but it's also a type of influenza. So it's basically influenza A, H3N2 that's happening side by side. COVID-19 has also shown an upstick over the last few weeks.
You are right now based in Delhi. We have our people who are watching us across the country. A lot of people from Mumbai, from Pune, from Bangalore, all the places where we've had very heavy instances of COVID infestation in the past, and not very happy memories, right, of what happened 3 years back. The first wave, Delta, was disastrous. What are the early signs that you see right now?
If you talk about the symptoms in general, it's very difficult to differentiate between COVID symptoms and influenza symptoms. So my first advice to people would be not to worry overtly, but at the same time, take adequate precautions. If you look at the general symptoms, most of them would be common. They would be fever, a bit of body ache or severe malaise, then cough, sore throat, sometimes running nose, along with vomiting as well as diarrhea. So these are the symptoms which might happen in COVID, which might again happen in an influenza or H3N2 affliction of a particular patient. Having said that, in COVID, what we saw over the last 2 or 3 years was a loss of taste and smell. Now, loss of taste is probably still there, but not so much of loss of smell. But that again cannot be taken as a differentiating factor, because often what happens is people who are having seasonal flu tend to pop antibiotics and end up having a loss of taste as well. So if you look at symptoms, you cannot differentiate clinically too much on the basis of symptoms between COVID and H3N2. But the precautions that we need to take are, be very careful, because while on influenza, in case of influenza, it tends to affect children less than 8 years and those more than maybe 60 or 65 predominantly. COVID-19 tends to affect all age groups, including young adults as well. But in both the cases, and particularly in case of COVID, there's a possibility of it getting complicated even more, ending up affecting the lower respiratory tract, then, causing a lot of respiratory distress, breathlessness, etc., which is not so much of a symptom or a complication of influenza, except for the compromised ages, like very young children or very elderly. So obviously, while I'm saying that, symptomatically, they cannot be differentiated much, we need to have a very guarded approach and take adequate precautions, as well as visit the doctor immediately after having any of these symptoms, like not to, sit at home and then wait and watch.
So tell me, what are the basic symptoms? For instance, if I am, I just have a cold.
Yeah.
I have some cough.
Yes.
Is that something that I should be worried about, or only when it develops into a fever do I need to worry about that?
See, a lot of people are now starting off with a little bit of sore throat, then a little bit of, running nose, and maybe on the second or third day, they move on to, develop fever. It may also be the other way around, that people are starting off with fever and then developing cough, running nose, etc. So, obviously there is not too much to worry, because it could just be a seasonal flu, which would really pass off on its own over a period of maybe 4 to 5 days max. At the same time, because we are again seeing an uptick of COVID, we should keep that at the back of our mind. So I would say, even with, developing with a sore throat, a little bit of fever, then maybe only sore throat and cough, it is always best to actually speak to a doctor or consult a doctor. Because what we are seeing in the health advisory from the Ministry of Health and Family Welfare as well, about 92% of patients with H3N2 are also developing fever as the first symptom. Then around 85 to 86% are having cough. Around 27% only are having breathlessness. So these are more of a statistical analysis, but that is what is being given in the health advisories also, that, do not neglect a cough or maybe a fever. So I think it's very important that we do not take over-the-counter medicines and, just treat them ourselves, but definitely seek a consultation.
Tell me, in terms of, if one doesn't have all of these things, but how do you just ward off the threat? So obviously the good old things of masking up,
yes,
N95 masks, hand hygiene.
Yes.
What else? Avoid crowded places, but life has got back to normal.
I know, life has gone back to normal, and I was just traveling. I came back day before yesterday. So in the airports, again, you see people are not wearing masks. So of course, life has gone back to normal. But I think particularly for people in the elderly age group, so I would say maybe 60 or above, particularly 65 and above, Then again, young children should take more precautions, should start, and in general, people should probably start masking up a bit, wear masks, particularly in the crowded places. Maybe not when you're sitting in a room, 2 or 3 of you at a distance. You know, in the COVID times, we were wearing masks even at that point of time. But I think probably as a precautionary measure, it makes sense to wear masks in crowded places. Then because influenza as well as COVID-19, they tend to spread through aerosols. So that is respiratory droplets. So it's very important to wash your hands frequently, sanitize your hands, then cover mouth and nose while, coughing or sneezing. Then to take plenty of fluid. That's very, very important. So what we should not be doing probably is shake hands or, use contact greetings. So I think it's time again, we take a step back from these things that we'd gone back to, then eating together in very close proximity of others. So I think a little bit of COVID precautions would be really helpful for all of us.
Obviously, no, it's all easier said, right?
Yes, absolutely. So while like I said, I was traveling, so I did use a mask. But of course, it was like 98% of the people want. And you cannot expect people again to be, going back to those days. But with what's happening around, I think it's very important that people in the elderly age group as well as young children be asked to start wearing masks. And we, the young adults, should also be masking up in the crowded places. These are all precautionary measures.
Just taking your case, you
Yes.
were masked up, but others were not.
Yes.
Is there any point then masking up? Because if others are not masked, does it really help you to ward off the threat?
There was this WHO and the CDC, that is the Center of Communicable Diseases from the US. They'd done a very nice study during the COVID times, where they showed 2 people wearing masks, then maintaining a distance of 6 meters. So then what happens at that time? What is the possibility of spread? Then 2 of them, but 1 person is wearing a mask, the other is not. And then both are without mask. So obviously it is a little bit of protection for myself also if I'm wearing a mask, not as much as as when the other person is also wearing, but at least some sort of maybe a 30% protection for myself. And so also if the person wearing the mask is infected, he would, and the others around him are not, even if the infected person is wearing a mask, it would decrease the possibility of the droplets spread from him to others. So obviously there is some sort of protection, even if it is not 100%.
Almost 99% of our readers, of our people who are watching today, they are all senior citizens.
Yes.
And a lot of them do have domestic help.
Yes.
Do have people coming in to help them in their various day-to-day tasks, etc. Now, in COVID, this was a challenge. Is it something that we should be looking at, as a worry now as well?
Absolutely, yes. Particularly for senior citizens, it would help if, when the domestic, to make it compulsory for the domestic help to be wearing a mask when they enter their house. And if possible, themselves also use the mask when the domestic helps or maybe drivers and others are in the vicinity. That would really, really be helpful. To make it definitely compulsory for the helps around, but if they could at least use it for they themselves could also be using the mask when these people who are coming from some other place are in the vicinity. That would really go a long way. And I really strongly recommend that even for my family members.
This is the last week, and the next week, we have a host of holidays and people are going to go holidaying and short vacations, etc. Is that something that you would recommend at all? Travel?
I think right now there's no advisory against traveling because it has been restricted. I mean, the number of H3N2 cases are also restricted to around 6 to 7 states as of now. But of course, for ourselves, even I don't think we should go back to the COVID times immediately. But for ourselves, even if we are traveling, like I said, use masks when we are in a crowded place. Then if you are traveling to some other place, we continue to wash our hands or at least sanitize our hands, use masks wherever it is possible. I think these are small steps which would really help us just protect ourselves. These are just precautionary measures. It's too early to say where it would lead, because like I said, it's a mix of H3N2, the seasonal flu, and COVID. So all of these 2 or 3 things which are happening simultaneously, not a lot of people are going in for testing also, though it has been recommended that at least 25% be tested on RT-PCR, but it's not actually. A lot of people are taking maybe a paracetamol at home or consulting their doctor, not really going in for testing right now. So the numbers may not be reflective of the actual numbers on the ground. So it helps if we take precautions at individual levels.
Right. Doctor, we have quite a few questions that have come in, so I'm going to take them. So there's one from Mr. Brish Duggal, who's 78.
Yeah.
He's taken the influenza vaccine 22, yes, and he's now being told to take a vaccine for 23.
Yes.
It cost me 1,800.
Okay.
What is the system distribution of influenza vaccine? And is it possible to take it from government agencies? Obviously every year you have this vaccine and you have people who are retired and who are living off their savings. Are there facilities, are there government agencies which will be giving this at a lower cost?
See, I'll tell you why we need to. First, I'll just come to this point, why we need to take influenza vaccines annually, like compared to a lot of other vaccines which we maybe taken when we were younger and never repeated it later. So that is because, like I said in the beginning of this discussion, that influenza virus undergoes a lot of mutations. So the strains keep changing continuously. The World Health Organization has this body which continuously monitors the influenza virus that's happening. It was H1N1, so then now H3N2. So, and there are many others in between also, which we really don't get to know of. So what they do is they regularly update their directory and the genomic variation of these particular virus, and accordingly give advisories to update the vaccines as well. So that's how, and these vaccines have a very short, impact on our life. Within a period of few months to a year, the antibodies start to wane off. So that is why it is very important that even, a particular influenza vaccine or particular vaccine, influenza vaccine, may not be exactly matched to the strain that's going around, but still it helps. And particularly in younger people, even if it is not totally matched, it helps to have the vaccination done, because it will provide a whole lot of coverage. But in the senior citizens, what it does is it helps to prevent the complications, particularly the ones who have maybe a heart or a lung ailment, diabetes, or some other immunodeficiency disorder. These influenza vaccines go a long way in preventing long-term complications. So coming to his question, what I would like to say is, because it is not a part of the universal immunization program as adopted by the government of India, it may not be available through government agencies. But at the same time, if you are a beneficiary of some health scheme at your state or central level, you could probably be able to avail of it.
Right. So, Doctor, right now, we are in the year 23, and is there a fresh influenza vaccine that has come out this year?
Yeah, it is there. And basically what happened is, like I said, influenza has 4 different subtypes, of which influenza A and influenza B are the most common. And the ones that we talk about, like H1N1, H3N2, are all subtypes of influenza A. So previously what was happening is a mode of trivalent vaccines were available, which covered, influenza A, both the subtypes of influenza A as well as influenza B. Now we have quadrivalent vaccines as well, which would take care of both A and both B subtypes. So that's why, like I already mentioned, depending on what strains are going around in the environment, the WHO keeps updating itself, and the vaccine producing organizations also adopt themselves and acquire these strains in the vaccines that they prepare.
And are there any side effects of the vaccine? For instance, with the COVID vaccine that one took,
Yes.
there were some people who had fever and there was pain in the arm, etc., etc. Is that something that one should budget for?
Of course, with COVID-19, people did complain of symptoms that you are mentioning. With influenza vaccine, there is no severe symptom which has been reported. But of course, because some of them are, live attenuated vaccines, some are inactivated vaccines, different types of vaccines are available. There is a probability that people might have a low-grade fever or maybe a little malaise for a period of 1 to 2 days, but that would just pass off on its own. There would be nothing to worry about. I mean, the advantages of getting an influenza vaccine are much higher compared to the disadvantages associated with it.
And you would advise that one should take an influenza
Absolutely,
vaccine?
yes, particularly for children, pregnant women, then elderly population, then ones who are, having some associated conditions like maybe diabetes, then some immunodeficiency disorders, etc. So for them, it's definitely recommended.
Right. Doctor, we have a few questions which are, okay, let me take this. This is from Mr. Lakshminarayan.
Yes.
It says round 1, 2 in 2020-21, there was a fear element. After 2 shots and a booster, plus braving 1 round of COVID on average, one is not worried anymore. Some have lost close ones. People are beyond caring. How much will the mask help, he asks. And he says there are people who also feel like it's a marketing strategy to sell these vaccines by giving a fear of death. This stems from the way target-driven doctors who have created business opportunities on many scared senior citizens. What is your take? A very direct question, but this is something which a lot of people feel. And, the pharma companies are doing this to help their businesses, and they're causing this fear.
I see. Well, a lot of it had been spoken about during COVID times also. But of course, a lot of us have lost very near ones. So we know that, not all of it was fake. It was very, very real. And like I said, right now, the severity of COVID had already decreased over the last 1 year. Even for those, we get samples for COVID-19 RT-PCR testing in our lab. We'd obviously seen a decrease in the positivity ratio, and we'd also seen, patients, the CT value was different. So when we got back to the patients, we got to know that the severity had also decreased. It was much less because obviously maybe the virus again got mutated to a lesser severe strain, etc. So right now it is very difficult to predict and say how severe the strain going around is, but it always helps to take precautions. And, masking or maybe, cleaning your hands regularly. These are very small things that we can do for ourselves. So, of course, there's a lot going on around, a lot of discussion around, it being hyped or overhyped. But a little bit of it is very, very real. So I think it helps us to take the adequate precautions just to protect ourselves and, at an individual level. And with regards to the vaccine, influenza vaccines have been around for a very long time. Even children are being regularly vaccinated every year during this period of seasonal flu, what we call commonly. But what we've seen, is even if a person has taken vaccine, influenza vaccine, even for kids, it does not prevent a total, fever or cough or maybe a flu, so to say. What it really does is it helps it being less severe. So while you maybe not be able to totally prevent it after taking a vaccine, you can at least reduce the complications. So that's where the role of vaccine actually comes in.
So, doctor, should one start taking these Zinkowitz and all of that? I was putting it out from my from my drawer and trying to figure whether one should pull it out and start having these, medicines so that you build your immunity. Is that something that one should do to
So,
ensure?
of course, I mean, whether you take medicines in terms of multivitamins or not, you should obviously have lots of fresh vegetable and fruit, and maybe build your immunity in a natural way. Have lots of fluid, like I already said. So those things, and once in a while, it doesn't harm to have multivitamins as well. I do.
There's a question which is there from an anonymous attendee, that if you have symptoms like cough and fever, what test should be taken, H3N2 or COVID? How does one differentiate? And then next question which is there is that, if one doesn't know what it is, if
Yes.
it's just a flu and it's a cold, it could well be H3N2, it could well be COVID. So are there any general medicines that one should have? Is that some general treatment?
See, what I'll tell you is, what I feel is sometimes we tend to be over enthusiastic and tend to overdiagnose also. There's a lot of flu happening around. So probably pre-COVID, people would not go in for testing, right? But now with the fear of COVID in our minds and the severity of influenza as well, so testing is important, but it does not mean that with a little bit of sore throat or a bit of, feeling malaise or fever, you immediately need to get yourself tested. I would still recommend that you speak to your doctor, maybe do a teleconsultation, and then basis the symptoms and his advice, go in for testing. And I'll just come to the diagnostic part in a little while. If a person definitely is having fever, sore throat, then cough, running nose over a period of maybe 1 day, and seeing that it's not subsiding with paracetamol alone, because even the MOHFW says, you can take paracetamol with fever. But if you're seeing that your fever is not subsiding with taking a paracetamol, and it's increasing, the feeling of well-being is not improving, your cough is deteriorating, then it's definitely very, very important to get yourself tested immediately. And in that case, it's not always important that you have to go to a laboratory. You can book. A lot of apps are now available where you can directly book your tests. So somebody would come to your house and collect your sample. So that saves you the travel part of it also. Particularly, I'm talking about senior citizens. And then, so what tests to go for? Now, basically, for any of these tests, we recommend a nasopharyngeal swab test or an oropharyngeal swab. So respiratory panels are now available with all of these diagnostic chains. So wherein you have the option of choosing what test you want to go for. Like at Redcliffe, I can tell you what we are having is we have a complete respiratory advanced panel, which takes care of influenza A, influenza B, H3N2, as well as H1N1. So if somebody goes for the respiratory advanced panel, they need not select H3N2 separately or H1N1 separately. All of these four would be tested for at one go. And along with that, COVID-19 testing can also be asked for. So basically, like I am repeatedly mentioning, that clinically on the basis of symptoms, it's very difficult for a person or even for a doctor to say for sure that, yes, this is because of COVID or this is because of H3N2. So it helps to go in for that spectrum of tests, which would cover all of these 4 or 5, viruses.
Doctor, one of the problems which was there for COVID testing was,
yes,
especially if you go to the labs,
yes,
is that before you give the report to the patient, one copy goes to the government.
Yeah.
And then what happens is that there are, various restrictions that are there, and just as people are worried, people are scared about COVID, people are also extremely scared about the ostracization. You can't
they are being ostracized, surely,
etc., etc. So would you then recommend a rapid antigen test, a home test as it's called? Is that good enough?
See, rapid antigen test for COVID is definitely available. So that can be done at home. That's not a problem at all. But with respect to the rapid detection tests for influenza, though they are available, they are not so much in use in India, particularly because there are still concerns about their sensitivities. Okay. So, of course, rapid antigen testing at home through these home test kits can definitely be done. But the proper protocol, as mentioned in the inserts, need to be followed. And the main idea, particularly for going in for testing, in this case, right now the severity of COVID may not be very high, or maybe for influenza, as we know, the severity is not very high. But what a diagnosis would help do is, number one, it would help probably take adequate precautions at home too, so as the people in the immediate vicinity or in the same household are not affected, because the patient immediately isolates himself. And the second thing is to be starting to take treatment if required, so as to prevent further complications. But right now, even as per the government advisories, etc., with a little bit of fever, etc., a paracetamol should help. But we should keep a watch on the severity or the worsening symptoms. That's when diagnosis and treatment becomes very, very important.
I was sure somebody would ask this question. Doctor, when we took the COVID vaccine, we were advised not to have any alcohol for 2 weeks.
Okay.
Is it the same with the influenza vaccine also?
It is better, definitely. Because like I said, these are, some of them are live attenuated vaccines, particularly the ones which are available in many countries as nasal sprays. Then there are some which are inactivated vaccines, etc. So definitely helps to, just hold on to it for around 2 days and let the vaccine do its own work. Just a day or two would help.
Right. And is there any other vaccine that one should take along with the influenza vaccine? And then one is taking a vaccine, so you may as well take 1 or 2 more at the same time. Is that something that one should do, or one should just stick to only the influenza vaccine?
No, right now, it's, most of us are, in fact, even the senior citizens are already vaccinated with 2 doses and a booster dose of COVID. So as of now, that is totally done. What would definitely help is to take influenza vaccines, the annual influenza vaccines. So that's the only thing that's recommended.
But, we've been, some doctors have come in the past and they've said that annual influenza vaccine for India typically is best taken around August to October, which is when, you have the rains or it's getting cold, but it's all right to take it now.
It is all right to take it now. It's absolutely all right. And, vaccines don't work once a person is already infected. So it should be taken as a preventive measure. So right now, when there's an upsurge in influenza cases, H3N2 is nothing but influenza, right? So, or in fact, the other strains of influenza A or B, when there's an upsurge in influenza cases in India, it really makes sense to take vaccines as a preventive measure. So even if somebody has not taken it last year, it would help to take it this year.
Right. Thank you. We have 2 questions which are left. One is, this is Mr. Sham Mittal, who is 72 and based in Delhi. Persistent coughs even after attack treatment is over. How does one deal with it? And we have Mr. KD Prasad Rao, who says he has severe diarrhea. Is it because of COVID? Yeah, these 2 questions,
I'll take the first one first.
Yeah.
So if for him, it's not subsiding even after repeated treatment, Delhi has a very high level of pollution. So sometimes it may not be because of influenza or COVID. It could be because of the pollution. It could, or maybe dust, etc. Obviously, that the AQI index in Delhi is so high. So it could just be an allergic cough. So I would obviously suggest that even after treatment, if it's not subsiding properly, he should consult a pulmonologist or a respiratory medicine specialist. That's very important. He could also get himself tested for allergies. A lot of places now offer these allergy panels, which help to identify the individual allergens, whether it's dust or mold or something else. So he could get himself tested for these allergy panels as well, which would probably help him identify if the cause is an allergic cough. So that is one. Now, coming to the second question about diarrhea, I would like to ask him if it's possible whether it's accompanied with fever, cough, or any other symptom. Is it possible to ask him?
Yeah, he's listening in, so I'm sure he will respond. So let me take another question then in the meantime. This is from Katie Dadanji, who asked, Doctor, are the nasal drops for COVID made in Hyderabad as effective as the COVID booster jabs? And are they, first of all, available?
See, they've all been tried. A lot of clinical trials are still going on. And I believe that, a lot of them have actually passed through the initial clinical phase trials and have been made available for use. But having said that, if you have already received 2 doses of vaccine and a booster dose, you really needn't go in for an over-the-counter nasal spray just like that. I mean, you still would be having antibodies in your body to combat an infection if it is of the same strain. So, just going for an OTC nasal spray by yourself without the advice of a doctor is not really recommended.
Doctor, I must tell you, I'm using this Suffer app just now.
Okay.
And the Delhi AQI, overall AQI, is 74.
Yeah.
All right. And what is it in Mumbai? In Mumbai, with all those construction happening, it is 86.
Okay.
Yeah. And in Pune, the AQI is 85. So Delhi, by the way, is perhaps has better air right now.
Yeah, probably it's probably because of the rains that's happened over the last few days. So that sort of clears up the air. I think that could have, but I mean, this is really good news from you because 74 is really, I mean, amazing for Delhi by Delhi standards.
Dr. Sengupta, it was really good that you came in. I'm not asking all the questions right now, so many of them are similar.
With respect to the diarrhea, I'd just like to tell him that
he has mild fever. He had mild fever.
Okay, so of course we probably will not get more details, but what happens is, of course, diarrhea can be an accompanying feature with fever, both in case of COVID as well as influenza. But if it is not, if it is not improving, like I said, there's severe diarrhea, which is watery stool and all, he should supplement with oral rehydration medicines which are available. He should take plenty of fluid because in senior citizens, the water loss tends to make them very, very weak and dehydrated, and it happens suddenly. So that's why that water intake, coconut water, oral rehydration salts, all of these need to be supplemented. Because it could be, or it may not be related to any influenza or COVID-19, or it may be also because he also had a bout of fever. And if it does not subside on its own, then definitely he should, consult somebody.
Thank you, Dr. Sengupta, for coming in at very short notice. We just felt that it's good to have somebody speak on this topic, and it was interesting to have somebody with your profile, somebody who is into medical, biochemistry and the like, which is a very growing area now. It was interesting. You put down all the facts, and you've mentioned about the need for an influenza vaccine. Those of you who can take it, please go ahead and do that. And there is need for taking care, for masking up, ensuring that you are not too adventurous. Perhaps ask your domestic help to start masking up. And when the domestic help is coming into your room for doing the jhadu, pocha, katka, whatever you call it, the sweeping and sopping, ensure that both of you are masked up. And don't be too adventurous. We hope all of you are safe. I'm sure you will be safe. And we've done it all in the past. It's just a question of, it's another summer, and the summer of 23 should be as safe as the various summers before 2020. Thank you very much, Dr. Sengupta, for being here. Those of you who would like to attend the health webinars, you can pre-register so that you'll always be there on our database, and we will send you the registration link. We are always there on Saturday evenings at 5 p.m. You don't need to get a watch or a clock for yourself. If it's 5 o'clock, we are there on health webinar on a Zoom room near you. And we'll be there next Saturday, that is April 8th, for another session of Health Live at Senior State.
Thank you very much, Mr. Pradyuman. It was really a pleasure discussing with you. Thanks a lot for having me.
And all of them, as you saw, Dr. Sengupta, they're all senior citizens.
Yes.
And people of all age groups, right? 80, 65. There were just few who are 65. All of them are very old, and they are all very active on Zoom. Some of them are regular listeners, and it's really heartwarming that you could answer all the questions that they gave.
Thank you. I hope they find it useful and it helps them.
Thank you very much.
Thank you. Thanks a lot.
Subscribe now and press the bell icon. Never miss an update.